like to introduce you to Garrett Stone. Let me ask the room, have you ever been in a session of physical therapy?
Yes.
Okay. Did you find that your mood and your motivation was tied into how well that went on a particular day?
Yeah.
Definitely we see that there's this interrelationship that exists there, and that's one of the things that Garrett wanted to look at and see what things might influence that mood and motivation. So, Garrett, you're up.
We did an experimental study of the individual and combined effects of full spectrum light therapy, peppermint sin administration on reduction. So we know that both full spectrum light therapy as well as peppermint sin administration have their documented benefits towards overall mood improvement. We know that full spectrum light has more so of an antidepressant effect, but with peppermint sin there's conflicting evidence. There's research that suggests that peppermint sin has a calming effect. However, there's also research that went towards looking into cognition and attention span. They did find that there was an improvement in cognition and attention. However, they believe that it was due to an increase in alertness, which causes like a differing effect, or I should say a contralateral effect to calmness. So it's conflicting with that. With both of those treatments in mind, we sort of put two and two together to see if we can get the benefits of full spectrum light and the benefits of peppermint scent to yield sort of like a synergistic effect with the two combined. So with respect to individual treatments in detail, light administration is an evidence-based treatment for seasonal affective disorders, which is defined as depression related to like a decrease in sunlight with respect to the change in seasons, such as in the fall, winter time we get less sunlight. It is hypothesized to be related to the sun, which inhibits our melatonin production through a regulation of our circadian rhythm. Now with less sun, we're going to get more melatonin, which is going to make us feel fatigued as well as sort of like moody as a result of like more sleep or even like less sleep sometimes. With respect to the different types of like light and as well as lux ratings, so a lux rating is basically how bright a light hits a surface at a specific distance. So in the bottom picture here with the lux, where the light is the brightest, that is at 800 lux, but at say, that's at 1 meter. At 2 meters, it's 200 lux. It's not as bright, it's not as intense. So with respect to light administration, it's documented to be effective at a lux rating of 5,000 to 10,000 lux at a distance of about 1 to 2 feet. So you have to be somewhat close to the light in order to get a decent effect on it. With respect to color temperature, you have the color that's most resembling to the sun is the most effective. So with color temperatures, we have 3, 4, 5, 6,000 K. 5,000, 6,000 K is where we're going to get more resemblance of the sunlight, and we're going to have more of like a energizing effect versus a 3,000, 4,000, which is like less resembling the sun, and it gives a more of like a fatiguing, tiring effect. It kind of helps us sleep a little bit. Overall, light was found to have a greater reduction in depression symptoms, improves overall mood regulation, as well as helps regulate our sleep. With respect to sin administration, it is not an evidence-based treatment. You have to consider that different scents have different chemical makeups that yield different effects. The three big scents that have been really researched has been citrus, lavender, and peppermint. Citrus more so has like an energizing effect versus lavender, which is more of like a relaxing effect. Or with like peppermint scent, there's sort of like a conflicting evidence here. It's more so like a best of both worlds situation. It has like an energizing effect as well as like a calming effect. With respect to the combined administration, what we found, study one compared, so they did a study on peppermint scent administration combined with light, and they were measuring systolic and diastolic blood pressures. Before and after treatment, they measured those blood pressures, and afterwards they found that there were significant reductions in combined administration versus individual administration. With individual administration, there really wasn't any significant reductions, is what they found with that. And with study two, they measured frontal EEG asymmetry. This one didn't necessarily measure with peppermint, it was with vanillin and as well as lemon oil as well. But with respect to scent, they found that treatments significantly reduce negative asymmetry, which is essentially one has greater negative asymmetry in the brain whenever they're like more so depressed. It basically means that one side of the brain is doing more work, and so that sort of leads to a more like a behavioral activation, specifically with the left lobe. With the right lobe, it's more so like a behavioral avoidance. So with bright light and peppermint scent both have their documented effects towards mood. It is unknown whether or not we can combine the two to get the best of both worlds and have a synergistic effect towards mood. And our objectives, of course, to confirm the individual effects as found with previous studies, as well as to determine if a synergy exists with combined administration. We hypothesize that we will find similar results as other studies have found with individual administration of both light and peppermint scent. And of course, results of combined administration will both yield a synergistic effect. Alright, so just a little bit of literature review. Dawn and Jacob, they examined the combined effects of light and peppermint scent using a profile of mood states. I will talk about that in detail later because it is one of our outcome measures. In general, it measures overall mood disturbance. So if someone's more angry, they're going to be overall mood, like have a disturbance in the mood. They found basically when light and scent were combined, there were significant reductions in the profile of mood states versus when they were individually administered. There was no significant individual. Smith and Alucobon, they compared the effects of administration of the vanilla and lemon oil scent. I've already mentioned this one, but this one also looked at continuous short duration versus long duration non-adaptive. So it's known that the sensory system, after a prolonged administration, will adapt to the administration so that it no longer becomes perceivable. Like we've all been in a room where we smell something and then we no longer smell it. That's sort of our sensory system adapting to that smell. So they wanted to see if the treatment would be more effective in a fashion that would prevent that adaptation. So it would be longer duration. However, it would be in like a triangular pattern where they would sort of start with like a low dosage and gradually increase the dosage so they could reach their max dosage, and then they'll immediately decrease it, and that was within like a span of like 30 seconds on, 30 seconds off. It essentially prevents the sensory system from adapting to it. And they found that there were greater significant reductions in the longer duration non-adaptive stimulus versus continuous short duration. Lamb and Levitt compared bright light and fluoxetine, which is an SSRI antidepressant. They found that bright light was just as effective as fluoxetine in reducing the scores of the Hamilton Depression Scale. And that scale basically just measures overall depression. Mawson and Witt compared the effects of peppermint scent and ylang. They found that ylang had a more calming effect. This is where the complex of research comes into play. They found an improved cognition and mood with peppermint as a result of increased alertness, but they came to the hypothesis that there was like a decrease in calmness as well. Alright, so on to the methods of our study. Recruitment emails were sent by my advisor to the Dean of the Health Sciences of Lone University. We managed to get one participant. Now that email included a poster flyer that contained like just the general like procedure the participant would take in, as well as an email to a survey monkey that I was able to contact them and set up a schedule. The profile, so these are our outcome measures that we use. The profile of mood states list is a list of 65 mood adjectives that describe the participant using a 5-point scale. These adjectives will be described as like, are you feeling friendly? Not at all, or extremely friendly. Are you feeling anxious, sad, etc.? Those types of adjectives. And it would rate it on an overall mood disturbance, and it would also rate it on the subscales. So it would have like a specific number for anger, confusion, depression, fatigue, tension, and vigor. For the Beck Depression Inventory, that one's a 21 multiple choice question representing symptoms or attitudes indicating depression severity. Some questions involved with that one are sort of like more specific. One question might be, I do not feel sad versus I am so sad and unhappy. And that would be a 0 to 3 scale, 0 being I do not feel sad, 3 being I am unhappy. So or higher scores indicate greater depression. Same with the profile mood states. A greater score of mood disturbance means that they may be more angry, more confused, more depressed, etc. With the state trait anxiety inventory, that one just is sort of like a distinguisher of anxiety from depression. It's 20 item rated on a 4-item scale. So with that one, it sort of determines if you are anxious as a result of right now, or are you anxious as a result of like, are you more prone to anxiety? For instance, the situational is more of like, are you anxious right now? Versus personal, which is, are you more prone to anxiety from that? Are you more prone to worry, for instance? For instance, a question might be, how tense or worried are you, or do you feel right now? That would be a question that would be on a 4-point scale, like not at all to extreme. So we provided full spectrum light using a 120 volt, 60 hertz light box. It was rated at 5000 K, which is sort of on the light end. It's not 6000 K, it's 5000. 10,000 lux, which is a very potent dose of light. Peppermint scent was provided by an AirSet New Life oxygen concentrator, which basically we had this tube connected to this device that would flow through this bottle full of like peppermint scent oil, and then this tube would essentially be directed into the cubicle where it would sort of aerate that oil, and then the scent from the oil would be fumigated into our cubicle so that the peppermint can be administered. And this light was, they were sitting right next to the light, so they were within 1 to 2 inches or 2 feet of the light source. So procedure on day 1, consent form was provided, which laid out the whole procedure. There are no known risks to being administered light or peppermint scent. Before and after this treatment administration, the POMS, the BDI, and the STAI were to be administered. If we have more participants, we would have partaken in the Latin Square administration, which is a way of randomizing the administration with each participant. But for this participant, week 1 was the control, week 2 was peppermint scent, week 3 was full spectrum light therapy, and week 4 was the POMS administration. Treatment time each time, so we did it for 3 days for 4 weeks. Each treatment time was 30 minutes. And this is just an example of the Latin Square administration. Okay. So table 1 is our alcohol measure data prior to testing. So what we did was, for each day, we had to do the alcohol measures before and after. This is the before. We took the average of those 3 days. And so prior to treatment and before, we took those averages prior to treatment, subtracted those to the averages after treatment to get sort of like a mean difference to see how much reduction occurred before and after treatment. Because we didn't have a great amount of participants, we weren't able to do significance. We were only able to sort of go by mean differences. And this is the outcome measure data after testing. And I'm going to just break down each outcome measure and their mean differences. So for the Beck depression inventory, light had the greatest overall reduction at -5. Light and scent was second in the greatest reduction, and scent was third at -2. And you can see in the chart, light had the greatest reduction as well. For the state trait anxiety, for the situational part, light had the greatest reduction at -12, whereas light and scent had the second greatest reduction. However, it was kind of like with the control, so not really effective there. But scent on this measure did increase the score to 2. For the state trait anxiety personal, light again had the greatest reduction in reduction in score at -7. For this one, scent was actually the second greatest. And then light and scent actually increased the score for this one. And then somehow they reduced their scores at the control. Profile mood states overall mood disturbance. Light had the greatest reduction at -17. Light and scent was second at -9. Scent was the third greatest at -6. So the participant there were days where the participant didn't have any anger. They scored a 0. So they're with light, I believe it was the after fact that they had like a -1. but they scored zeros on prior to testing, so that's why they're sort of a -1. Same thing with light and scent. So with respect to anger, there's really not much to go by here. If we have more participants, we can measure this a little bit more accurately. Participants may be preferably a little more angry. Profile mood states with respect to confusion, light and the control were equal in -3, scent was -1, and light and scent actually increased confusion. With respect to depression, light had the greatest reduction at -3, light and scent second at -2, and scent at -1. And fatigue, light was at -4, which is the greatest, scent was at -2. Light and scent had no effect in reducing fatigue. And then attention, light had the greatest at -9. Light and scent actually increased the score for tension at +2. Then, yeah, that's it. Scent had no effect on that one. With respect to vigor, light was at -3, scent increased the score at 3, and light and scent was -1. On to the discussion. So the aim of the study was to, of course, verify the individual facts from previous research as well as explore the potential for synergy. We treated them with bright light at 10,000 lux, peppermint scent, for 30 minutes, 3 days per week for 4 weeks, and we used the POMS, the BDI, and the STAI. Overall, light had the greatest reduction with the majority of the outcome measures. Peppermint scent did increase the scores for the STAI situational, which means greater anxiety in the moment, as well as vigor. It did not have the greatest reduction in any of the outcome measures. Now, with respect to combined administration, the greatest reduction occurred with anger, but take that with a grain of salt. The participant was really angry, we couldn't accurately measure that. It increased the scores for the STAI, personal confusion, and tension. So the results of the study do support what other studies have found. Laminin and Vic compared bright light to fluoxetine, which showed that it had equal effectiveness in reducing depression. That's likely why we saw light having the greatest reductions in the majority of our outcome measures, likely due to it being as equal in effectiveness as essentially a drug. Moss and Hewitt compared the effects of peppermint scent and ylang. They found that it increased alertness but decreased calmness. That's likely why it had the third greatest reduction in scores in depression and anxiety. With respect to that. And with respect to combined administration, the results do not fully support a synergy. Light overall had the greatest reductions. Now, if there was a synergy, we would at least see that there wouldn't be like a halving in reductions when they were combined. Like what we saw with light having like significant reductions, we wouldn't see that get halved when peppermint scent was combined. Like for instance, like it was 17 for the POMS overall, and then peppermint scent brought it down to a -9 when combined. And overall, in combination, there were less reductions in scores. In contrast to our results, Don and Jacob examining the combined effects using the POMS. The results were significant when they combined the treatments, however, they were insignificant when individually administered. The strengths of the study pertain to our room size, which allowed for potent administration with respect to peppermint. Well, we utilized, so most of the studies that study bright light have used like 2,500 lux to 5,000 lux. We went all the way up to 10,000 lux, so that was also greater potency. And the testing routine was maintained and kept consistent as to keep the participant comfortable as to not disturb the results of the immediate outcome measures. Limitations, unfortunately outside the laboratory we cannot control the noise conditions. We only have one participant with greater respect to anger, that was more so of an effect. Continuous administration, and we did continuous administration, which is shown by other studies not to be as effective. And with respect to our sensory system adapting and it no longer becoming effective. However, we did use a greater potency, so that may have countered that a little bit, but it was unclear. There was no screening of olfactory function. It is unclear if like the participant was able to like smell or if they were ever like, if they ever had a stuffy nose that may have affected them being able to perceive peppermint. Application, so the results definitely demonstrate a significant efficacy in utilizing bright light to reduce depression, anxiety, and overall mood disturbance. Further research is definitely needed preparing continuous versus non-adaptive administration, as well as with respect to like profile mood states and anger. Get more participants to get a better anger analysis there. In relation to physical therapy, a patient's mood can easily affect their outcome measures. If they go in and they're either anxious or they're sad, they're likely not going to participate in our therapy as willingness. But with lighting, we can tremendously boost their outcomes with a brighter light, as well as like a light that's a whiter-ish color. With respect to peppermint administration, it can be beneficial. If you're going to use anything other than peppermint, it is important to be aware of the effects that different scents have when utilizing them. However, with peppermint, that'd probably be more useful if you're wanting the patient to be more cognizant or to pay more attention to, say, education, or if you're like instructing them to do something. And that is it. Questions? Yes.
Just out of curiosity, what time of the year were you doing this? Just thinking about seasonal affective disorder and could have a greater or lesser effect with the light that goes out of the winter versus.
It was during October all the way to December.
Okay.
Other questions?
What modifications might you make to the study if you were to do it again?
I would say definitely probably a greater ventilation with respect to the peppermint administration. Like for me personally, when I walked in there, like I'm a fan of peppermint, but when I walked in, I was kind of like, ugh. So maybe like better control of just how the peppermint is sort of like administered so that it's more comfortable to receive, if that makes sense. Other than that, with respect to the light administration, I don't see, I mean, some of these other studies, they have these like specially crafted like goggles they put on, which just pretty much allow for greater control over like the ramping for